Today we are going to study about the disease of eyelid. First one, some congenital abnormalities. First one is epicanthus, the most common congenital condition, a seminular skin fold situated above and sometimes cover the inner canthus, usually bilateral and stimulate and the appearance pseudo-convergent squint. It is normal in myoglyph case, easily treated by plastic repairment. Epicanthus means is common condition in congenital, and it means is the semi-lunar skin fold that's situated in a inner canthus. Next one is coloboma of a eyelid. It is also a common cause of in congenital. First one is a notch at the edge of the eyelid, the most commonly in the middle of the upper eyelid, often associated with underlying dermotic cyst. Treatment is a plastic repairment at a very early age to prevent explore keratitis. Coloboma is look like a notch at the edge of the eyelid. It is commonly in the mid of the upper eyelid can be seen. It is associated with the dermoid cyst. Next one is blepharospasm. It is a symptom consistent following clinical features: narrowing of a vertical and horizontal palpebral apparatus, telecanthus, invert epicanthus fold, and ptosis. And second one is autonomial nominal inheritance. Treatment is plastic reconstruction of the lid alone with bilateral brows suspected in a ptosis in this stage. In blepharospasm, it is a narrow or vertical horizontal palpebral aperture. Telecanthus next the invert epicanthus fold and ptosis mainly seen in this blepharospasm. And next one is dystrachiasis. This extra posterior row of ciliary occasionally present in all four lids. This posterior row occupied the position of melalbin gland, and melalbin gland change the ordination sebaceous gland in this condition. The eyelashes may irritate the cornea. Treatment is done by cryotherapy or extensions with grafting. In dystrachiasis, the eyelashes are grown in inward directions of both four eyelids can be seen. Its posterior rows is occupied the position of melalbin gland, and melalbin can change its ordinary sebaceous gland also. Eyelashes may irritate the cornea also. The treatment is cryotherapy. And next one is the abnormalities of shapes and position. First condition is ectropion. Entropion is an inward turning of eyelid with rubbing of eyelashes on a conjunctiva and or cornea. In entropion, the inward turning of eyelid which rub the eyelashes to cornea and conjunctiva. And classification is first one involutional, the most common type and affecting the lower lid only. And etiology is due to four changes: upward movement of periseptal part of the orbicular oculus of the lower lid, and second one a thinning of the tarsal plate with subcutaneous atrophy leading to the horizontal lid laxity, and thinning of orbital septum and weakening of the lower lid retractions leads to decrease in vertical lid stability. And fourth one is the relative disparities lead between the lid and globe from atrophy of the adipose tissue. And symptoms of entropion is foreign body sensation, pain, lacrimation, and discharge. Signs: it turns of a lower eyelid, conjunctival conjunction, discharge with the mating of eyelashes, blepharospasm, and specific corneal opacifications and disorders of the window reflex. Sometimes corneal ulceration may be seen. The main symptoms and signs are the foreign body sensation. First one is foreign body sensation, pain, lacrimation, and discharge. And signs: the eyelids are turned, lower eyelids, and conjunctival congestion discharge may have blepharoplasm also seen, and superior corneal opacifications can resulted and sometimes diagnosed by the corneal ulceration. Next one is treatment. The two types of procedures are temporary procedure. Temporary procedure, first one is adhesive tape, pulling the skin outward with the strip of adhesive tape. Next one is cuttery over the skin above the eyelashes, and inverse lid everting suture and alcohol injection along the edge of the eyelid. Permanent procedure is Will's procedures. Will's procedure is a full thickness horizontal lid splitting with a marginal rotation, horizontal lid shortening, an extension of a full thickness trapezoid shapes area of the lid at the lateral canthus, and then suture the margins to treat the horizontal lid latency, and tucking of inferior lid retraction. It may be done in a primary procedure or a retracted case. And the fourth procedure is excision of the base down triangle of a tarsal and conjunctival and then switch together. And next one is cicatricial. It is due to the scarring of palpable conjunctiva. It may involve both upper and lower lid. Frequently, the tarsal is deformed and thickened. Causes: chemical injury, lateration injury, trachoma, radiations, Stevens-Jones syndromes, ocular, cicatricial. Then treatment is aim of the treatment to keep the eyelashes away from the globe. First one, soft contact lens is various plastic operations, and the ideas are to after the direction of the eyelashes to transplant the eyelashes to strengthen the distorted tassels, and mucous membrane grafting, the bulk mucus of replacing of scarred conjunctiva. An aqueous plastic, it is a result from the excessive construction of orbicular oculi. Its effect mainly in lower lid. Causes is chronic conjunctivitis, keratitis, and post-operatives. Treatment is removal of the cause and its results. Removal of bandage in a post-operative cases, and temporary relief by lid, evade suture and adhesive tape. And congenital types, it is very rare. It is rare and usually caused by the deformity of the tarsal plate. It may be associated with microphthalmus and anophthalmus. Sometimes epiphlorone may cause congenital entropion. It is an abnormal fold, usually at the middle 1/3 of lid, and the turns the lid margin inward. Treatment is retractions of abnormal portion of tassels, and excessive skin may be excited with the epiphlorone. And next condition is ectropion. In ectropion, it is the outward turning of the eyelid away from the globe. And first one is clinical features. In case of low lid, involvement of inferior punctate is not contact with the globe. An epiflora and the exflora of the around the lid. The chronic explosion of the conjunctiva, secondary infection, and a keratitis, and frank corneal ulcer. In entropion is a inward turning. In ectropion is outward turning of the eyelid. The classification is lower lid is involved, and a second one is chronic explosion of conjunctival secondary. Classification is involutional, means saline. It is the most common form which affect the lower lid. In earlier, it is due to the excessive horizontal lid lengthening with the weakness of the periseptal portion of the orbicular oculus. It is most common form. It form in most early in lower lid, and excessive horizontal lid lengthening and weakening of the periseptal portion of the orbicular oculus. The lid elasticity can be assessed with the snap test. Pull the lower eyelid downward and assess how long it takes to return the normal position. The returning of a less than 1 second is without blinking is normal. And treatment is the correct by the reduction of the horizontal lid elasticity is first one category. To correct the middle eyelid elasticity with the punctual evaluator and middle conjunctiva plastic is a mild case of the medical ectropy. Horizontal lid shortening to correct the ectropy involving in a whole lid, and brick procedure is access the full thickness of triangle which wedge of lid at the outer canvas, and this sutures is vertical. And Brown Smith modifications is the another type is a wedge resections of the lid margin along with the excision of the triangular skin flap laterally. And cicatrical types, it is a cause by the contraction of the skin and underlying tissue causing burns like chemical or thermal trauma inflammation. It is effect either in upper or lower lid. Treatment is excision of the scar from the skin graft to a raw area. Skin of the opposite upper eyelid is ideal for a purpose. Lengthening of a vertical shortening of the lid by Z-plasty. And next one is paralytic. It is followed by the paralysis of orbicular oculi and is also associated with lack of thalamus. Treatment, the main aim to prevent the explore keratitis. In middle case, the frequent installation of artificial tears to prevent corneal dying. The second one is antibiotic ointments or adhesive tape to close the eyelid at night to prevent the corneal exploration. In severe case, is shortening of a peripapillary apertures of a lateral trophy and the awaiting of spinal recovery, and lateral catoplasty is acceptable cosmetically corrected by silicone. And next one is congenital rare and may be associated with blepharospasm. In severe case, surgery is necessary. In mechanical, it is a skull or swelling of lower lid, example the large chelation, a tumor, even lid enema, it can be easily treated. And next one is trichiasis. Trichiasis is the inward misdirection of eyelashes which irritate the cornea and or the conjunctiva, and pseudotrichiasis which is misdirection of secondary to entropion. In trichiasis, the inward misdirection of eyelashes is causing which may irritate the cornea or conjunctiva. In pseudotrichiasis, it may caused by the entropy. The inward turning of the eyelid can also misdirection of eyelashes may cause. And next one is etiology of congenital known as dystrichiasis. Acquired due to the disease can cause the scarring of eyelid margins, tie, ulcerative and blepharitis, membrane conjunctivitis, trachoma, and post-traumatic. And symptoms of trichiasis is foreign body sensation, lacrimation, and pain. In trichiasis, they may cause the foreign body sensation, lacrimation is watering may cause, and pain is also presented. And next one is signs of a trichiasis is conjunctival congestion may present, reflex blepharospasm, ciliary congestion, recurrent erosions of a cornea, superficial corneal opacification, and the vascularization of cornea may be. Treatment is epilation, removal of often eyelashes from ciliary forces. It's must repeated every 6 to 8 weeks. Soft bandage contact lens to protect the cornea temporarily, and permanent procedures is to destroy the hair root is electrolysis. Under local anesthesia is done. A fine needle, a negative pole is introduced to the hair follicles, and the current is a 2 ampere is passed. End point of the judgment of appearance is formed, and the eyelashes is root can be easily left out, and the dermal. A current of 30 ampere is used for the 10 seconds, and cryotherapy is very effective for the row of ingrowing eyelashes. Under local anesthesia, the probe is applied in a lid margins and freeze at a 20 degrees Celsius, prolonged through the refreezing the pigmentation of the skin in a problem. And next one is radiation is affecting the cervix, but procedure conjunctive keratitis action. Organ laser cilia is also effective, and plastic repairment is may cilia of misdirection protective procedure as entropion is a most effective. It's all are the permanent procedure is our electrolysis, electroradial and cryotherapy, radiations, organ laser, cilia and plastic repairments are all are the permanent procedure for dystachiasis. And next one is lag of thalamus. It is the condition in inadequate closure of the eyelid result in exploration of the eye. Lateral abdominis is a Greek word of hearing and animals which always sleep within open eye. In this condition, the patient is not able to close their eyelid properly. Etiology is it is found in a children's and terminal ill patients. It causes no trouble since the eyelid is rolled upward, the Bell's phenomena, simultaneously during the sleep. Signs: facial palsy, ptosis and thyroid exophthalmia, coma patients, and psychiatrical deformations of the upper eyelid. Symptoms are eye is red, irritable and watery, dryness and lower part of the bulbar conjunctiva and cornea. Explore keratitis, corneal ulceration and corneal perforations are the symptoms. The eye are seen in a red color, they are irritable and watery eye. Maybe it's dry in cornea and bulbar conjunctiva is in lower part, mostly dryness. Explore keratitis is a corneal ulcerations and corneal perforation. Treatments is not does not require any treatment. Installation of artificial tears at the day and antibiotic ointments at night is required, preventing the corneal drying. And closure of lid is adhesive tapes is used, and soft corneal lens is allowed the artificial preventively explode keratitis. And temporary or permanent adhesives is creating between the upper and lower lid, which may be laterally and paracentral. And lid lot operation is a gold plated used for the facial palsy. Treatment is caused by the ptosis due to the orbital tumors of the thyroid exophthalmia. And next one is symblepharon. Symblepharon in these conditions, the adhesion of the lid to the globe as a result of adhesion between the bulbar and palpebral conjunctiva. Its main condition is adhesion of the lid to the globe. It's a result in adhesion between the bulbar and palpebral conjunctiva. Etiology is any cause which produce the raw surface